Hey everyone, last week I put out a letter on the private insurance company program falsely called Medicare Advantage, named that way because they want you to think it's part of government traditional Medicare. It is not. Instead, Medicare DisAdvantage, that's what I call it, is working right now to privatize Medicare and make your healthcare even more unaffordable so that they can pad the pockets of these CEOs and big private insurance companies. I led a record 77 members of Congress in pushing Trump to protect our incredibly popular Medicare program, which provides health coverage for 67 million Americans, and pushing them to crack down on the waste, fraud, and abuse of Medicare DisAdvantage. Medicare DisAdvantage is run by private insurance companies. You may have heard some good things about these disadvantaged plans because the corporations that run them spend a lot of money on advertising and use the name Medicare so that you think it's run by the government. Medicare DisAdvantage promises better coverage but delivers worse results while costing taxpayers more, billions more. These private insurance companies take shortcuts and put profits over patients. These Medicare DisAdvantage plans also overcharge the government by $83 billion, literally stealing money, and none of that leads to better health care for you. Medicare DisAdvantage enrollees often face all kinds of additional requirements, like prior authorizations that allow them to deny, delay, and disallow your health care needs. In 2022, Medicare DisAdvantage plans denied 3.4 million prior authorization requests for health care. That's private insurance companies saying no to your doctor, your health care needs, just so they can stuff their own pockets with taxpayer dollars. Their number one goal is to increase profits for their CEOs, not to give you affordable quality health care. And now they're working with Trump to completely privatize and take over Medicare, which means that you would face higher costs, more denials, and worse care. We say no to all of that. My letter pushes the administration to stop the overcharging and fraud in these Medicare DisAdvantage programs and strengthen enforcement against them. We say protect the traditional Medicare program that millions of Americans know, love, and rely on. And here's the thing. If we actually took the tens of millions of dollars that Medicare DisAdvantage plans overcharge the government and we invest that money into traditional Medicare, we could afford to add dental and vision coverage. We could get rid of copays and cap out-of-pocket spending. We can strengthen and expand Medicare and build on our success rather than subsidizing private insurance companies. So how about if the Department of Greed and Evil, DOGE, stops the wasteful spending right here by cracking down on Medicare DisAdvantage? Let's put people over profits and invest in the health of all Americans.